All right, awesome. So, Kayan, I have some questions, but those are just like whatever, like they're just guidelines, just suggestions, and then we just kind of take it as it goes, and we can go anywhere from that. So that's not a big deal at all. And I'm just going to pull them up so I have them. So no stress about that because that's just kind of like in case we run out of whatever something to say, it's just some guidance. Um, and so Alan like edits all of this. Nothing is live, so we can always go back and questions. Do you have any questions? Sure, sure. So, you know what? I had, Vivian, right? Vivian, I don't know what her last name. She was on my podcast before. And so, what we talked about was a lot about how GI disorders can affect intimacy and relationships. And how, like, for example, like Crohn's disease or IBS, or let's say, for example, someone has a colostomy bag or something like so just basic stuff, right? And how they can keep the intimacy alive in their relationship. And but then if there's something that you want to focus on, like I know you did a reel about something, and I was trying to find that again. You posted that in our private practice docs. And if you want to talk about, I'm going to say it says you feel fine, you can have liver disease and not fatty liver explained for the patients and people in your life at risk for, mass LD. So that must be the fatty liver disease, right? And for those who actually have it. Yeah, yeah, yeah. So we can talk about that as well, right? Because you talk about fatty liver. So, I mean, any of those, like it doesn't matter. The point is just to talk about kind of what you specialize in and how that relates to intimacy and how patients can talk about, right? Like patients that have liver disease, right? How do they move forward from that? What are some treatments? And how does that affect a relationship, right? Stuff like that. Yeah. I'll weave it in there. Yeah. Yeah, yeah, it's okay. No wor Yeah, it's okay. We'll figure it out. So it's not a big deal. And, we just talk about kind of liver disease, right? Like, I don't really I've never really talked about liver disease, but, I mean, I feel like all diseases affect relationships in one way or another, right? Like, somebody has liver disease, what can they do for that? And then what does that do to a relationship? I don't know, whatever. Or does it show up in perimenopause or menopause or something like that? Okay. Well, we don't have to focus on that. Yeah, no, actually, you know what? I think that what you're talking about with lifestyle, I think is fantastic. And also about metabolic health, I think that so all of the things. So I think that, we can just start off talking about what it is that you do, right? What it is that you focus on and how metabolic health really is actually paramount in midlife women and in perimenopause and menopause. And we know that a lot of metabolic diseases show up in perimenopause as the estrogen starts to decline. And then you can start talking about lifestyle changes, right? Lifestyle modifications, how we see obesity, how we see GI. So, we can put it all in. It doesn't have to be specifically like intimacy related. Yeah, of course. Of course. Yeah. 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 No, yeah. Yeah, yeah, yeah. And so, perimenopause, and we can get so let's get into it because what I'm gonna talk about is I'm going to let you and these podcasts typically they last about like 45 minutes to an hour, but we can make it shorter if you need to go, whatever, or something like that. You just let us know. You know, okay. Okay. All right, great. So I'm going to go ahead. So what I usually do is I introduce the podcast and then I let you introduce yourself and then we just get into it, okay? And then we just start talking and then it's really like easy, like no big deal. And we don't I'll just look at the questions just for some ideas, but I really want you to highlight like what you do, really focus on your, lifestyle medicine, how you integrate GI disorders and obesity medicine, how that shows up, blah, 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 like fatty liver, all that stuff. I mean, I think that's great. I don't have anything on that. Kayin. Kayin. Okay. Thank you. Sadaf. It's, Sadaf. Sadaf. Yep, perfect. Yeah. Yep, it's fine. Okay, awesome. All right, Kayin. So I'm going to go ahead and get started and we'll go. So, Alan, are you set? All right, thanks. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf and this episode is everything you need to know about GI disorders, lifestyle medicine. Okay, hold on one second. This episode is everything you need to know about GI disorders, lifestyle medicine, obesity medicine, all that great stuff. But before we get into it, first thing I want to make very clear is that this is not any type of medical advice. So if you have any questions about your health, make sure you go speak with your healthcare provider. And of course, as always, this is no advice on religion. So if you have any questions about your religion, make sure you go speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm super excited to have on with me Dr. Kayin Jeffers. Dr. Kayin comes in from Atlanta, Georgia. So, Dr. Jeffers, welcome to the podcast. If you could please introduce yourself to all the listeners and the viewers out there, that'd be great. I'm impressed. That was great. Okay. I'll do Alaikum Salam. Those are a lot of board certifications, by the way. It's a lot of studying. That's amazing. So, I'm curious to know what inspired you to focus so much on so, I mean, like, so you have so much training. I think you win for the most educated physician on this podcast ever, with the most definitely with the most board certifications, that's for sure. But, what inspired you to focus not only just on GI disorders and hepatology, but also obesity medicine and lifestyle medicine? Was it something that you were seeing in patients over and over again that you felt like, if you had these extra trainings that you could really help patients? Awesome. So, what are some of the most common digestive issues you see in your practice that surprise you that you think that maybe, had they chosen a different lifestyle or maybe exercised more or, that they could have avoided some of their digestive issues? Mm. It's so interesting. When you were talking about colon polyps, I was thinking about so in the WHI study, that came out in 2002, it said what they noted in the WHI study was that individuals that were on menopausal hormonal therapy, right, they noted that whether they were taking estrogen alone or if they were taking estrogen and progestin, that they noted a decrease in colorectal cancer. Why do you think? Yeah, I don't know if you know anything about that. If you don't, we can talk about it something else, but yeah, no, Kayin, I think that you make a very good point, actually. And when you mentioned visceral fat and you mentioned metabolic health, we know that a lot of metabolic diseases show up in midlife. We know in perimenopause, and I actually feel that perimenopause, I feel, is a window of opportunity for women to kind of change the trajectory of their life, to change let's say, the chronic conditions that may develop, right? So we know that in midlife, we know that estrogen is fluctuating. We know that progesterone is starting to go down and testosterone also is starting to go down. We know that due to that, a lot of women can become pre-diabetic. They can have increase in their cholesterol. They can start to have increase in their blood pressure. And so when you talk about these metabolic conditions starting to show up, it absolutely starts to show up in perimenopause. And so I really advocate for women to, take a hold of their hormones, really optimize them if they can, especially if they're starting to experience perimenopausal symptoms, because really, and we know this from the WHI study as well, is that we know that estrogen helps prevent diabetes. It prevents insulin resistance. And when you talk about visceral fat, we know that there's absolutely an increase in the amount of visceral fat as we get older. And we know that there's a redistribution of fat for women specifically as they're going through midlife into, from perimenopause into menopause, as we lose that estrogen, that fat that used to be around our hips and our thighs, it becomes, it goes more toward our abdomen and becomes that visceral fat. So I'm so curious, and I'd love to hear your thoughts more on visceral fat and what that does to our body. Yeah. Absolutely, absolutely. So if we're talking about, when we're talking about perimenopause, menopause, the mean age for somebody to go through menopause is around the age of 51, 52 here in the US. Perimenopause, as you know, is a time before menopause, and it varies by ethnicity. And we know that based on the SWAN study that was conducted in 1994, which was this multi-center study, and it looked at women through midlife. And what it noted, and what we know because of that study, is that, African American women go through perimenopause for at least 10 years, sometimes even 20 years. Hispanic women go through perimenopause for about 8.9 years. Asian women, 5 years. We know that South Asian women about 8 to 9 years. So we know Caucasian women for about 7 years. Um, And so if we do the math, right, like, so if we're thinking that the average age for menopause is 52, then, and if African American women go through perimenopause for about 10 years, so we're thinking like in the early 40s. So we're thinking that but for some women, so we have premature ovarian insufficiency that can happen when women lose their ovarian function before the age of 40. We have early menopause that happens before the age of 45. So there are different ranges. So we see like, so your question, right, was like, when does perimenopause start? So perimenopause can start in a woman's late 30s and go all the way up into, until she has her last menstrual period. For some women who have PCOS, it can even be as late as like 55, 56. So there's a huge range there. Yes. Mhm. Yeah. Sure you are. Yeah. Yeah. Mhm. Yeah. 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 Absolutely. Yeah, no, I think that's fantastic, and I think that's a great correlation. What, lifestyle modifications would you suggest? I know you mentioned it a little bit, where you were talking about sleep and things like that, but what are some lifestyle modifications that you think are just non-negotiable for individuals that are trying to maintain a healthy lifestyle, trying to avoid, like, let's say, worst case, we're thinking like GI cancer, what would be some key lifestyle, habits you would tell somebody to instill in that time frame that you were saying, right? Like that opportunity, that window of opportunity. Yeah, Yeah. Is turkey bacon the same? Is turkey bacon the same? I know, right? Really good. Yeah, yeah, amazing. Sleep, I feel like is been talked about over and over again, and I'm so glad you mentioned that. And didn't realize it was so important in gut health too, but I guess it just makes sense, right? We hear about the gut brain connection all the time. What does that actually mean? Yeah. Yeah, I'm so glad you mentioned that because I was just thinking about the gut microbiome. And there was this one GI doctor that I was listening to, and she mentioned about eating things starting with the letter K, like kimchi and kiwi, and drinking kombucha. And so I'm curious what you think about that to help with the gut microbiome. Yeah. 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 What do you think about like the gut microbiome? I think you mentioned this a little bit before about gut microbiome and hormones. So I know that like the satiety hormones, right? We have those that let us know when we're full, and we know that in perimenopause and menopause, those start to shift a little bit as well. Maybe you can talk a little bit about those gut hormones that let us know when we're full and what happens when they're not working. Mm. Yeah, and so what we've also noticed is that, women and so there have been lots of studies that have shown this, that women that take menopausal hormonal therapy along with a GLP-1, they tend to lose more weight. And, and they believe that it has a lot to do with, the estrogen and how that affects the satiety hormones, and it just helps those GLP-1s work a lot better. So, as opposed to if we did, a lot of women will do, they think that menopausal hormonal therapy or just taking estrogen will help them lose weight. And it doesn't really help women lose weight, perhaps indirectly, where like if somebody's sleeping better, right? Like you mentioned, right? The number one lifestyle modification that you wish everyone would do is get better sleep, right? Sleep 7 to 9 hours. But we know that in women that are in perimenopause, menopause, that are having hot flashes and night sweats and things like that are not sleeping well, and their sleep is broken throughout the night. And so, they're not rested. They're not making, like you said, if you're better rested, then you're making better food decisions later on and when you're up and awake and things like that. But if you're not well rested, you're probably going for more of the higher glycemic index foods, right? Which then of course is like this um circular behavior, right? Exactly. Where now you're like eating this and then, it leads to more insulin resistance and increased visceral fat. And the visceral fat has its own hormones. And so all of this stuff. But they know that, once you're on menopausal hormonal therapy, so if you're sleeping better, if you have more energy to like exercise and make better food decisions, right, then you're going to lose more weight. And those GLP-1s are going to absolutely help you as well, because then they're going to help to regulate how much you're eating, and it's going to take away that food noise that a lot of people have, right, when it comes to hunger. And also, when we balance out the estrogen, and I'm pretty sure that there's a correlation between the satiety hormones and estrogen. And I believe that when the estrogen goes low, that satiety hormone also goes low. And so you can't tell, when you're full. And so you start to eat a little bit more. And so there's proven weight gain that happens during this time. And we know there's a redistribution of fat and stuff like that. So all of it is connected, and so what I think that what you're doing is also very, very important. And we know that is it tirzepatide, Zepbound that is indicated for, no, Ozempic is indicated for MASH. Is that correct? Uh, yeah, for yeah, so can you explain a little bit more about what that is and how that comes about? Is it just in patients that are overweight or obese that end up with fatty liver disease, or maybe you can tell us a little bit more about that? Terminology. Mhm. Yeah, no, I think that's so important to know that that MASH, correct me if I'm wrong, so MASH is preventable, yes? If we can yeah. Interesting. It's amazing. Yeah, yeah. That's amazing, actually, when you were talking about that, and we know that, Ozempic, the GLP-1, is indicated for MASH, it also helps to decrease our cardiovascular disease as well, doesn't it? It's indicated for that is and so that's really, amazing because it would be like one medication taking care of so many different things. Actually going back to what we were talking about with the ghrelin and the leptin, I actually looked it up. And was it low estrogen actually causes a decrease in the sensitivity of leptin. So the satiety hormone, right? And it also is often associated with an increase in ghrelin. So the hormone that causes us to feel more hungry. And so that's one of the causes of weight gain in perimenopause and menopause. Yeah. Yeah, they're in the gut, right? They're in the gut hormones? Yeah. Mm. Mm. Sensitive. Yeah, yeah. That's amazing. That's amazing. I love that. whatever. Yeah, 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 right. I love that. That's so important. Yeah, no, and that is such an important concept, and all the more reason for us to be having our 25 to 35 grams of fiber every single day, right? And, so that it can produce the body can produce its own GLP-1. That is so fascinating and so important, and I'm so glad you brought that up because that is so key for all of us, and especially for women in midlife, right? They always say that women in midlife should be eating more protein and more fiber, but that's another reason for us to be getting more fiber, aside from the fact that, it really helps us to feel more full and helps us to keep us regular. But, I didn't realize the importance of fiber in the gut microbiome and in helping us to yeah, yeah, it's so, so important, and that's such great information. If you were to give for somebody that's watching this podcast and thinking, wow, Dr. Kayin is so amazing, he knows so much information. What is one, let's say, I don't want to say one, how about three pearls or takeaways that you want someone to take away from this podcast who's been watching this? What would be the three key things? That was fantastic. That's what it was. So for all those individuals that are listening and watching and thinking, wow, how can we hear or listen to or become a patient of Dr. Kayin Jeffers? How can they get in touch with you? Where can they watch more of the things that you talk about? Maybe you can let the audience know. Amazing. Well, thank you so much for coming on. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health, specifically GI health, then make sure you go see your healthcare provider. And until next time, this is the Muslim Sex Podcast. All right. Well, thanks so much for coming on. That was great. That was